We're going to give some folks some time to just join onto the call, and then we'll get started in just a minute. Everyone's still kind of trickling in. I will just go ahead and get this meeting going. Um, Thank you all for being here. My name is Deja. I'm Senator Ingram's senior legislative aide, and Amber is with us from Senator Hicks Hudson's office as well. Thank you so much for being here for the May 2026 meeting. We have an exciting day to learn more about a wonderful organization doing great work here in the state of Ohio. I will say, Senator Ingram, to everyone on the call that she is going to be maybe joining in a little bit later in the call. But we're in great hands with Olivia and Miranda. So let me go ahead to my next slide here. So Senator Ingram and Senator Hicks Hudson are the co-conveners of the Ohio Black Maternal Health Caucus. And also thank you to everyone who was able to make our amazing summit that took place last month. It was wonderful to see so many of you in person and just share a great conversation and get to be together, supporting one another in this work that you all are doing. So thank you for that. And then we're welcoming Pregnant with Possibilities today. Thank you so much again for being here and presenting on the work you're doing. Just a little bit. Oh, go ahead, Amber.
Sorry, Deja. I just want to add one small thing. As some people may know, we typically take a break over the summer break for the Senate. So next month will be our last meeting, just as an FYI. There's this month and there's next month.
Yes, thank you, Amber. So Pregnant with Possibilities was founded in 2015. It's in Cuyahoga County, and they're dedicated to transforming maternal and infant health outcomes through culture, responsive care, education, and advocacy. And they're doing amazing work up there supporting, mothers and families and their babies so that they're able to thrive. And then joining us today, Miranda, she is the founder and CEO of Pregnant with Possibilities Resource Care Center and Bloom Behavioral Health. She's a leader in health education and nonprofit service dedicated to empowering our youth, mothers, and family through trauma-informed care, mental health, support, and advocacy. And I know, Miranda, also joining you today is Olivia Davis, your care coordinator. And so I will go ahead and just shift it off to you all so we can get started into the presentation. And again, thank you all for being here. If you have any questions throughout the call today, just make sure to put that in the Q&A portion of the Zoom, or we should have the capabilities where people can raise their hand and just kind of talk out loud. I know in the past we kind of weren't able to do that, but I think now we should be able to do that. So yeah, thank you guys, and you can go ahead and take it away. I'll stop sharing my screen. Can you see it? Are we good? Good.
We can see it. All right, so morning, everyone. My name is Miranda Rogers. I serve as the founder, president, and CEO of Pregnant with Possibilities Resource Center. First and foremost, thank you guys all for being here. Learn a little bit about who we are, what we're doing in Cuyahoga County. I'm actually in DC because I am doing advocacy work as we speak. So I'm not stationary. So that is why Olivia is running point for us. But Pregnant with Possibilities was actually started in 2015. And so this is our 11th year of service. And we are absolutely committed to ensuring that we can change the narrative around infant and maternal vitality to ensure that every mom, every baby has a fair opportunity to thrive. We will explain how we do that through our services. Not only that, the foundational part of our work is ensuring that youth are educated around making healthy life choices and decisions. And we also offer maternal mental health. So we're dedicated to supporting those from the whole perinatal period, from inception until the postpartum period. Next slide. So I always like to introduce myself by saying I was born on purpose for a purpose and the purpose that I serve. My mom's own challenges with fertility. She actually had two ectopic pregnancies prior to my birth. The doctors told her that she would never have children. So I always say I'm an indication of the promise that children can be born, they can thrive, and they can celebrate major milestones. I actually also delivered my son 2 weeks after my 17th birthday. So navigating life with a kid, still in high school, graduating from high school, being a first generation college student, I knew that I thought I wanted to be in business and all of the things as I was navigating what that looked like. Thoroughly had a heart and a passion for infant and maternal health. Stories and my own struggles. I always you're not a part of the problem, you're a part of the solution. And so if you're not a part of the solution, you're part of the problem. So I'm thoroughly committed to making sure that we're supporting these three.
Miranda, I think you froze.
Yep. Nope, I'm kicking it over to you. Can you hear me?
Okay. Yes, ma'am, I got it. I'm Olivia Davis. I'm a certified community health worker, and I get to serve as care coordinator at Pregnant with Possibilities. My role is just supporting our families and birthing individuals and being that gap that connects them to the resources that they need within the community, so we can break down a lot of those barriers that we see. A little bit of why I do the work is kind of like Veranda. I have a purpose. I was a young mother who needed these services, who needed someone to walk alongside me and help fill in those gaps. Would have made things a little bit easier. So now I get to enjoy helping other people in that same role, just a little bit reversed. So that's a little bit about who I am. And that just goes into like our mission here at Pregnant with Possibilities, just to provide that support and the education, and just breaking down those barriers and resources so that we can help our individuals that are not only giving birth to healthy babies, but also helping them feel empowered and reaching their goals and purposes. And our vision is just that we have a community where every mother, baby, and family just feels supported, especially facing those great disparities that we see in Greater Cleveland, and giving them the access to the care and the resources and support they need just to thrive, and being able to access our behavioral health care via Bloom. That's a really good thing because we see a lot with mental health, and not having access to that. So we just eliminate those barriers, reducing the disparities and providing the compassionate support. And our goal is that in the future, where maternal and infant health is safeguarded, mental wellness is prioritized, and every family can flourish with dignity and opportunities. And that brings us into our tacos method, which is the foundation of everything that we do here at Pregnant with Possibilities. Transformation for us is transforming the lives of our clients and changing the systems, not just those statistics, because transformation happens when policies meet those lived experiences. And just bringing awareness and educating our communities, our providers, our legislators, just on maternal health and the outcomes we strive to see. Community is being shown through our care coordinators working alongside the community, in the community with our families, getting them to those resources, again, breaking down those barriers because maternal health outcomes improve when birthing individuals have that support. And we see that, with our outreach, when we're meeting our families where they're at, we're breaking down those barriers with outreach opportunities like our diaper distribution and community resource fairs that we have at Pregnant with Possibilities. And service, it's the heart of the work that we do. We provide exceptional care to every birthing individual and equally treat them with the dignity and respect that they all deserve because everyone deserves to feel safe during a vulnerable moment. So, uh, and I will give it back to you, Veranda.
Thank you so much, Olivia, for setting the foundation around who we are, the work that we do. So, our four core programs and services that we offer center around number one, our endless possibilities. And we have our mom program, we have the after party, and then we have our Bloom Behavioral Health program. I'll go through each slide just so you get a real understanding on how each program functions. So, our Endless Possibilities program is for youth in grades 6 through 12. We actually offer this in a community based setting in high schools, middle schools, and in community centers. Our goal is to support youth with healthy education to one, prevent all new STIs, which 50% of all new STIs are made up amongst youth 13 through 17, as well as preventing premature pregnancies. So this comprehensive program provides them with the tools and the resources to make healthy choices while focusing on their educational goals. Our secondary program is our mom program. This is for anyone who is pregnant or who has a child under the age of 1, and they must also reside in Cuyahoga County. It's a 13 series hybrid group based model of care, which we focus on a comprehensive model of care that has everything to support the family from community supports, education. They have a full care coordinator, they have perinatal and postpartum wellness. And it says people can see that I'm speaking, but they can't hear me. So can you guys hear me now? Uh-oh.
I can hear you, Veranda.
Okay. We also focus on mental wellness. So we have pre and postnatal yoga. So we have 6 pre and postnatal yoga sessions that allow family to access on demand as well as guided meditation. We have a full pantry. So we say our program works when the family works it. And what that means is as they participate and they attend sessions, they meet with their care coordinators, they're earning points. Those points allow them to access our baby pantry. In our pantry, we have everything that the family can need from inception until that baby is 1. So car seats, strollers, pack and plays, diapers, wipes. They're also able to earn gift cards. A lot of the courses in education focus around the things that we see that impact the social determinants of health. So those things are stress management, it's lactation, safe sleep. It's around preparing the baby to be ready for development and the stages of development, what a mom should be looking for at each stage. They're also getting education around their own mental wellness, so maternal mental health. It has accountability, stress management. There's an educational component as well as financing and many more that I may have missed. We also focus on making sure that they have access to healthcare providers, and we have a full comprehensive. So whether they need doulas, they need midwives, we are a part of their care team, guiding them on their journey to ensure that they have a positive birth outcome. Once they graduate from this program, they're then able to move into our after party program. So this is for our mom program alumni. This is a year-long program where they meet for 1 year bi-monthly in person that focuses on mentor bi-monthly meetups, strategic family planning, and financial support. So as they're in our mom program, they actually design and create a family plan. What do they want for success? They also create a birth plan. We then expound on it in the after party and we meet it with a financial contribution. So the families actually save, we invest their money into a high yield savings account. And from the money that they have invested, we then give it back to them so that whatever they were working on in their family plan, whatever their top three goals were, they actually do a pitch, they have a presentation, and their peers are able to select who should win the funds quarterly for the after party group. So every quarter, we may distribute anywhere from $500 to $1,000 per family that wins the pitch to accomplish something that they have put in their family plan for sustainability. We have supported everything from continuing education, workforce development, paying off bills, all of the things that support sustainability. Finally, what we saw in COVID and probably 2 years after, as we know, social isolation was declared a public health crisis, families were disconnected, and 50% of all of our referrals were for mental health services. It was at that point that we needed to look into how do we address this barrier, because what we realized is that we were making referrals, but we weren't necessarily closing the loop. And when I say we weren't closing the loop, families had long wait times. Transportation was a barrier for them to even be able to access care. Maybe they couldn't even get behavioral health in their home because if you have multiple children who are not school age yet, trying to navigate and take them to mental health appointments can become a challenge. And so we knew we needed to do something. We therefore piloted a program called HOPE. HOPE stands for Healthy Outlooks on the Postpartum Experience. It's our group-based model to postpartum care. That group-based model is a 5-series workshop that has licensed therapists that are guiding our families along to identify a lot of the barriers that we see that often go unrecognized or undiagnosed. 1 in 5 women will have a postpartum diagnosis, and the majority of them aren't actually receiving any type of care, treatment, or medication. So, this was our way to combat some of the things that we were seeing. The Bloom ecosystem was then birthed. And so Bloom at Pregnant with Possibilities was created. And now, as a part of our work, we are Joint Commission accredited. We are accredited with the Ohio Behavioral Health Agency. We can take up to 7 managed care plans. And we provide one-on-one therapeutic counseling, case management, substance use disorder treatment, mental health assessments, and then our group-based model of care called the HOPE program still continues to move on. We also went to the Center for Community Health Worker Excellence because we work with community health workers every day is a core model of our work. And what we realize is that if you're not supporting the caregiver, then oftentimes there may be a disconnect or they may be re-traumatizing. They leave the field super early because they don't have the support, the resources, they're burned out, or they're traumatizing clients. So we created a program called Thrive, which is to support community practitioners to address their own barriers and heal within themselves so that they're not re-traumatizing the community. So that's another part of our work under our Bloom Behavioral Health platform to support the caregivers while also supporting the families that we support. So as we know, in Cuyahoga County, across the state of Ohio, I often say we have some of the best healthcare and some of the worst outcomes. These disparities are higher when you look at certain demographics, especially African American women. They're 3 times more likely to die from 80% preventable causes in the childbirth, as well as Black babies are 3 times more likely to die compared to white babies. And so that's what these charts are showing. And we've been talking about this for years, but our goal is to address these things each and every day. And as we address them, Olivia will actually share our impact and our QR code so that you can actually scan and see the impact that we're making in Cuyahoga County. But at Pregnant with Possibilities, our goal is to address every barrier from housing, transportation, just pregnancy related complications, access to care, being able to advocate for your own health and well being, And as staff members, we are on the front lines each and every day, being able to share the stories of our families, of our clients. As I told you guys when I started, I'm actually in DC. So I am thoroughly doing advocacy work even today, right now, in this moment. And so we will give a call to action for you, some of the things that you can do to actually help us move the needle, to be a part in advocacy in this work. So I'll kick it over to Olivia to finish, and then we'll open up the floor for questions at the end.
And then just kind of off of what Veranda said, and you can see in our impact report that we've supported over 202 families. We provided safe sleep education to 96% of the families that we helped to reduce those preventable infant deaths, a 73% breastfeeding rate. 47% of our clients reported a negative birth outcome experience prior to receiving support and advocacy. And those outcomes include low birth weight, preterm births, stillbirths, and miscarriages. And 70% of the families that we serve carried to full term births. And just like Veranda said, we just work every day to help improve those outcomes through our education, advocacy, outreach, and just direct support services. And the impact of the work that we do, it's not just measured in the numbers, it's measured in the healthier pregnancies, the safer births, and empowering these birthing individuals and families who feel supported. And this is why the work that we do is important. And if you do, so you can submit a referral online at pregnantwithpossibilities.org by connecting with us and then selecting referrals if you know anybody who could benefit from our services in Cuyahoga County or anything along those lines. This is how you would submit a referral, and one of our staff members would follow up within 24 to 48 hours. And then if there's any questions, Miranda, I can't see the chat or anything with the PowerPoint running. So,
No problem. I can't actually see the chat as of right now. I don't see any questions.
okay.
So I actually have one that I would like to start with while people
Okay.
are formulating their thoughts. I know that at the beginning of the presentation, and I'm sorry if I missed it, I was having a bit of a technical difficulty, but you mentioned that you have a youth program. And if I'm not mistaken, I believe that Ohio is an abstinence-only state as far as like public school sexual education. I know you said that that was a partnership with Cleveland Clinic, but could you talk a little bit more about that aspect of your program?
Absolutely. Not only is Ohio an abstinence-based state, we are also the only state that doesn't have any health measurements that we have to meet. And so we do have a direct partnership with Cleveland Clinic where we actually go into, as I said, community-based settings or high schools and middle schools to educate youth on making healthy life choices and decisions. So we have a 10 series program that focuses on everything from the risk and consequences. We talk about contraceptive methods. We talk about how education is important and to ensure that peer pressure and all of the things that youth are facing on a daily basis is at the forefront of the education components. We bring in medical providers for 4 of our 10 sessions to actually provide medically accurate information. Along with this program, we also have something called Real Care Babies. The Real Care Babies are our Real Care Babies are a simulated infants that we allow the youth to take with them for 24 to 48 hours. We're able to track the progress on how long the baby cries. We're able to track if they're actually changing, feeding, and it's a deterrent and a mechanism to show youth that life with a baby is expensive. So we even do a full breakdown and a model on how much it costs to raise a kid from birth to 5 years old. We do all of the expenses for the first year of life. And then they take these babies home. Long story short, after they take them home, they're like, yeah, we don't want kids. But it allows us to even see if there's abuse, neglect with them caring for the simulated babies that are in their care for the 24 to 48 hours. So that just speaks to our model to not only educate youth, we also sometimes see the parents that we're serving didn't have this information. because it doesn't have to be, it's not a standard that is taught in our school systems. We often have moms who think that the withdrawal method, which is the absolute least effective method, is the best method to prevent pregnancy. So we're like, okay, have you talked with your healthcare provider about the other 11 contraceptive methods, understanding that abstinence and condoms are the only ones that will actually keep you safe from both pregnancy and STDs or STIs. So our goal is not only to service youth, but it's also to educate birthing and pregnant individuals on the risk and consequences. And if you're not creating a family plan, then what is your next step for prevention or repeat pregnancies? And I hope that answered your question.
It definitely did. That was, oh, sorry. That was very extensive and it sounds like a very thoughtful program. Definitely something I think our school systems overall could probably learn from. And then we do have one in the chat. So Erica Gordon, who is also a doula, and has her own program that she's starting, um, has asked, how can we connect with you professionally?
Absolutely. And that will be in the slides that Olivia will share. She will actually post all of our contact information um, so that you can connect with us. We have a website, which is pregnantwithpossibilities.org. You can email us at info@pregnantwithpossibilities.org. And our phone number is also listed.
I have
And
a
then I,
question. Oh,
no,
sorry,
go ahead,
Amber.
Dave. Go ahead, Dave.
Well, I just wanted to follow up on like, Amber, asked more about the programming that you do, um, like with the youth and everything. And I know at least something that, I mean, obviously we're all here and, always advocating for these, better outcomes, for our mothers and the babies and everything. And I just am curious, maybe it's not that it would solve the issue, but I just wonder if you have an opinion that, like, if we were more intentional as a state and did implement more comprehensive, healthcare or health education standards, like in our schools, if that you think could have a possible impact as well, maybe in the way that we sometimes see these outcomes, maybe not solve it. I know that's not like the root cause, but I mean, especially with conversations that happen in the mainstream right now about we're in a negative birth rate and, wanting people to like have more children and things like that. I think that's interesting to like urge people to do that. But then we also don't set up our children. I mean, not that we want our children to have children, but you know what I'm saying? Like, we don't even hold it to a standard to have that be that information out there so that when you become older you might be able to have had that education to know like what to expect. So I wonder if you think that could be some sort of piece in the puzzle to kind of also help with these maybe outcomes that we see. I don't know.
Absolutely. So I do think as a collective, it's a whole ecosystem that is required to ensure overall we have supportive families, we have better outcomes. If we want individuals to have children, then they have to be very much educated on the risk and consequences associated with even sexual behavior and what that looks like. And not just utilizing, sometimes I say like fear tactics. I remember when I learned about sexually transmitted diseases, it looked scary to me. And so that created a fear like, okay, well, these are things that I don't want to do. But on the opposite side of that, as a parent, because I am a parent, I have two children, when I look at the cost of raising a kid right now, it's actually at one point I felt like I was working to pay for childcare. So we want people to have children, but then we don't have the necessary supports on the back end to even support them. But that's a conversation for another day. Saying that to say, I feel like it very much takes a whole ecosystem. I'm going to continue to say that of community members. How are we making sure that we're educating educators, schools? Oftentimes in this work, I see that most schools, most families, we're reactive instead of proactive. It's okay, now I have to address this situation. instead of how can we bring in education to support our children. And parents actually get to opt in or opt out if they even want us to come into their school building to educate their children, all of the things. It also means that we have to do our own due diligence to find the necessary funding to even bring in the education to support our youth. But once we are there and now we're supporting them, our goal is not pushing that they're having children early. I've lived through that experience, saying that to say that's not our goal, but our goal is to educate them so that they have all of the facts, they have all of the information to where they can make healthy choices. They understand things that can also put you in positions that will challenge or compromise your health or your well-being. So understanding peer pressure, understanding that sex is everywhere. It's in the music that we listen to, it's in the TV shows that we watch. So if it's everywhere, then why are we educating everybody, not only from our youth, but the families that we serve to make healthy life choices and decisions so that they have full understanding and knowledge um, as they move through life.
No, exactly. And thank you so much for that. I mean, it's just something that always comes up, at least here at the State House, the conversation about the health standards that's come up numerous times, when there's like other programs or other things and proposals. We kind of always bring it back to the baseline of like, well, before we get there, like we have to recognize we don't even have health standards that we integrate into our school systems. And so it's hard to put expectations on others when we're not even kind of, meeting that baseline to provide that kind of education to our communities intentionally. So, I mean, obviously you all are doing it, but from the state perspective, I know that's just a conversation that tends to come up pretty often. So I think it's great that you're doing that work in your community to educate the families and our youth as well. We do have somebody in the chat. Oops, I'm scrolling. Jackie Moore from Dayton. Let me see with, oh, my thing's not working here. So sorry.
I can see they actually want
Okay,
to
you got it.
connect and they have our information as well. If you want to connect with me directly, my email is my first name. So V as in Victor, ERANDA at pregnantwithpossibilities.org. Olivia can also share her direct email and she can, or put it in the chat. But our office phone number is there, our website. Even if you go to our website and you go to staff, about us, it will actually provide you with an email for every person that's on our staff if you want to directly email them as well.
And my email's simple. It's just care@pregnantwithpossibilities.org. So.
And
Thank
I
you. Mhm. Oh, you're good.
I just had another follow-up question as well. So I know that you talked a little bit about your behavioral health program that you have with the Ohio Department of, I believe you said the Ohio Department of Mental Health.
So we are accredited through the Ohio Department of Mental Health as well as we are accredited with Joint Commission.
Okay, yes. So that one, and then the perinatal support program that you guys have. I wanted to know if your programs are mostly oriented like just towards mom, or if because you mentioned the like baby that you send home and you have a whole curriculum of how to take care of a child, if that's integrated in the care that you provide to people who actually have become mothers or parents at the point in which they meet you, if that extends beyond just what you do with youth.
So that is a great question. So our Real Care Babies are incorporated into our mom program if we have a first-time mom who feels like she wants additional support. And sometimes we also have teen moms who enroll through our program. If we have a teen, we will absolutely send the teen home with a Real Care Baby. So those are just one-off situations that they're incorporated. But I will say the sexual health education piece, sexual risk avoidance is actually what we call it, is incorporated in our perinatal mental health, in our perinatal support program, not necessarily in the mental health side of the work that we do. The mental health side of the work that we do is very much rooted in health wellness modalities to ensure that families have all of the things, the items in their toolbox, or if they need a diagnosis, a treatment plan to ensure that they are set up for success. Because, as I said, 1 in 5 individuals will suffer from some type of mental health condition and they typically go untreated. That is actually what we were saying. We brought in a licensed therapist who was helping us in a lot of our work. And she was like, do you know that a lot of the families that you're supporting actually are suffering from other things and mental health? And what we actually do is something that's called tracing from both sides of the house. So with our perinatal support program, we use care coordinators. And so the care coordinators meet with our families on a monthly basis to do visits. And our mental health therapists actually sit together. We can all sit at the table and we look at a family's history. So, did they experience a traumatic situation in their childhood? And is that now playing out and maybe their adulthood? Especially if we see children being removed from the home and we're working on reunification and we need to put a safety plan in place, or we need to make sure that we have an accurate and adequate plan and course of action to support the family. We sit down and do tracing meetings as a collective staff to best support and provide holistic and wraparound support services around that family.
That's awesome. Thank you for that elaboration on what you guys do. It does really sound like there's a lot of possibility when people walk through your doors.
That is the goal. And not only even in our behavioral health side do we support them, we provide them with transportation, we provide them with childcare when they're in our space. We provide them with a full meal, because unfortunately, if we don't meet the basic needs of a family when they walk through our door, we can't give them any additional services until their basic needs are met. And I forgot to also mention, we even provide housing, rent, utility assistance. So those are just some of, as well as the tangible supports that we offer.
Wow, yeah, that is awesome. Thank you very much for that explanation. I currently don't have another question, but our chat is open if people have additional questions. Deja, I didn't know if you had another one as well.
No, not necessarily a question, just, thank you so much for the amazing work you're doing. And just like you mentioned, the ecosystem that's necessary to really see a real change in, these situations we continue to see. And the fact that your work extends far beyond just meeting with like a pregnant person, and it doesn't stop there. It's these other things that you do, like the rent help and just even getting someone a warm meal, that I know, again, here at the state, like when we're in a lot of conversations about policy, that the members are focused on things like that, it extends beyond just meeting with a healthcare professional, that there's a lot of other things that here at the state level, I know, Senator Ingram, Senator Hudson are always advocating for resources, because those are the real things too that improve these outcomes and improve the lives of individuals. And if we want them to have children, we want to be able to make sure there's some support system, especially for the organizations like you all on the ground doing that work. So I think that's super important to always remember, that it's not just when you're with the doctor. It's a lot of factors that come together to make those positive outcomes happen. So I think that's super important. And if there isn't any more questions, we can leave it up for another moment, but we'll be sure to share this will be uploaded on the Senate Democrat YouTube page. All of our recordings are there, so you all can always look back and reference this. And we will have one more meeting next month, kind of same time, same place. Usually on a Thursday at noon, the third or fourth Thursday. And then we'll be kind of taking a break over the summer. We'll put out probably a newsletter where we'll list all of our meetings we've had this year. Well, probably even maybe the ones from the last half of last year, maybe just so everyone can reference those, and maybe send out a survey to get some feedback and things like that. But we're definitely excited and thankful for everyone that's been continually participating in these meetings and just putting you all out there so that you can share the work you do, because it's great work. So thank you guys so much again for being here today.
Well, thank you guys so much for having us. We truly appreciate this opportunity and this platform to share who we are, the work that we're doing. I just leave with a call to action for everybody, whether you're a part of this work, working in the ecosystem, you decided to just join in. It takes all of us. Now that you know information, please share it with other people. How can we collectively reach out to our legislators? It takes us legislators changing policy, right? Family leave, family paid act, housing policies. I literally just got off a housing meeting before this, and as I am here advocating in DC for women's health issues across the board, um, we want overall better health outcomes for women, children. And so it takes each and every one of us working together to change that narrative.
Yes, and I just want to say thank you on behalf of the Hicks Hudson office as well. You guys do amazing work, and it was great to hear about it. Yeah. Okay, and then I guess also Deja said she'll be sending out the slides, but thank you to everyone who's joined us. Deja, I don't know if you have anything you would like to add, but reminding people that next month will be our last meeting, and then we'll break for the summer as the legislators are on their summer break.
Thank you all again. I hope you have a great rest of your day and have a good holiday weekend. So thank you.